Thanks for watching. This is YouTube Medical University. Quick question. Have you had persistent itching lately? Even though you don't have a cold, your voice is hoarse and won't get better. While washing your body in the bath, you found some kind of lump. Haven't you had experiences like that? You may think it's not a big deal and just ignore it, right? I understand how you feel. In our busy daily lives, we tend to ignore small changes in our own bodies. What if your usual symptoms are actually signs of cancer? What would you do? I'll share some symptoms many people don't realize could be linked to cancer. I'll review some surprising cancer warning signs hidden in common symptoms. For us medical professionals, some of these signs seem obvious, but for the general public, there are actually quite a few that aren't well known. By the time you finish watching this video, I think you'll have gained knowledge that can help protect yourself and your loved ones. And if you or someone you know has any of these symptoms, you'll realize that it might be necessary to see a doctor. So here is today's agenda. First, in the first section, I'll introduce 3 unexpected warning signs of cancer that are hidden in the skin, which is often called the mirror of the internal organs. Then, in the second section, I'll talk about surprising cancer warning signs that can be detected from things like hoarseness, which increases your risk by as much as 53 times, and nasal congestion. I'll introduce 2 of these signs, and then in the third section, I'll explain a simple way to tell the difference between dangerous lumps in the skin that could be linked to cancer and harmless ones, since some of you may have heard about lumps being a warning sign. Please listen until the end. Now, let's get started. The first topic is signs on the skin. It's long been said that the skin is a mirror that reflects the condition of your internal organs. Actually, this isn't just a superstition from a medical perspective. We often suspect cancer based on signs that appear on the skin. The first skin sign I'd like to introduce is persistent itching all over the body. The other day, a woman in her 70s, Miss A, came to my outpatient clinic. Doctor, for the past few months, my body has been feeling itchy and restless at night, and I can't sleep. I went to a nearby dermatologist and they suspected dry skin, but even after applying moisturizer, it hasn't gotten much better, she said. When I examined Ms. A more closely, I noticed that the whites of her eyes had also turned yellow. Suspecting something, I decided to run some tests. We found a very early stage bile duct cancer. Fortunately, Ms. A was immediately referred and was able to have surgery, and she is still doing well now. Why did her skin itch and her eyes turn yellow? Let me explain. Please look at this image. This is where the digestive enzymes coming from the liver go into a sac called the gallbladder. After that, the digestive enzyme called bile flows from the gallbladder into the duodenum. This pathway is called the biliary tract. If this biliary tract becomes blocked, the bile can't flow into the duodenum. Since the bile can't flow, it doesn't leave the body as stool. When that happens, the bile circulates inside the body, and since bile is originally yellow, the whites of the eyes start to look yellow. Additionally, the skin begins to appear yellowish. And when the flow of bile is blocked, substances that cause itching in the body increase. That's why Mr. A was complaining about itchy skin. I think it's easier to understand if you consider the reason behind it. Diseases that can block the bile ducts, for example, when a stone gets stuck or when cancer develops in the pancreas. And in this case, things like bile duct cancer can cause the skin to become itchy, appearing as a skin symptom. That kind of thing can happen. Other symptoms when bile is blocked include urine becoming yellowish. Those symptoms may also appear, so please remember them. Actually, symptoms like the eyes turning yellow or the skin turning yellow are also signs that can occur when the liver becomes unhealthy. Signs from when the liver became unhealthy in the past. We introduce various other things as well, so if you're interested, please check them out from the description below after this. 3 dangerous signs of cancer that appear on the skin. Here is the second one. It's shingles. I think those who have studied well know about shingles. I previously made a YouTube video about it. Speaking of shingles, it's a disease where red blisters or vesicles appear on one side of the body, accompanied by a tingling pain. I think many of you have experienced it before. Actually, if there are cancer cells hiding in your body, those cancer cells can weaken your immune system, making it easier for shingles to appear. According to a highly reliable study, cancer patients, especially those with solid tumors, which form lumps, are 5 times more likely to develop shingles compared to patients without cancer. And remarkably, people with blood cancers like leukemia are 10 times more likely to get shingles compared to those without such conditions. In other words, people with cancer are more likely to develop shingles compared to those without cancer, so it's important to be careful. Of course, just because you get shingles doesn't necessarily mean you have cancer, so you need to be cautious. However, if you keep getting shingles repeatedly, as for atypical shingles, it can appear not only on one side of the body but also in various places. In such cases, cancer or similar conditions are often involved, so please, if you get shingles, I think you should ask your primary doctor about possible cancer or related issues. By the way, do you know why the immune system weakens? Makes you more susceptible to shingles. Actually, most of you had chickenpox as children. The chickenpox virus actually stays dormant in your body for life. That dormant virus comes out suddenly when our immunity, which suppresses bacteria and viruses, decreases. It appears as a skin condition called shingles. Herpes is something similar. Herpes causes red bumps to appear on your mouth when you're tired. This is linked to your immune system and often shows up when you're tired. Please keep this in mind. This is the third skin sign of dangerous cancer. It's hives. Hives are a pretty common condition, aren't they? It's a skin change like this. Suddenly red bumps appear on your skin and they become very itchy. And one of the characteristics of hives is that in most cases they go away within a day. However, if hives keep appearing continuously, there are cases where the hives persist and the itching continues for a long time. According to a study from Denmark, people diagnosed with hives had about a 49% higher risk of developing cancer within 1 year compared to those without hives. There are reports like this. The exact reason why the risk of cancer increases when you have hives is not clear, but it is probably similar to shingles, where some kind of immune abnormality makes it easier for hives to appear. Cancer cells themselves may cause inflammation, and as a result, hives appear. Possible reasons include allergies causing hives, which is normal. However, if you have persistent hives without a known cause, at times like that, we medical professionals may consider the possibility of cancer. In addition, in a previous video about stomach cancer, I introduced something called laser trailer signs. This is an image of skin like this, but if something like a black wart suddenly appears on your body and is accompanied by itching, I introduced it as a sign that makes us suspect stomach cancer even more. In fact, besides what I introduced today, there are other signs of cancer that appear on the skin. So, if you're interested, please check out my previous videos here. Watch my videos on stomach cancer or malignant melanoma, a skin cancer type. Persistent, unexplained itching all over your body as well as shingles and hives. I introduced these symptoms as skin signs that could increase your risk of cancer. It's perfectly fine if you just think, is this really possible? So if you have these kinds of unexplained skin symptoms that persist or don't heal easily, please consider visiting a hospital. It might not just be a simple skin problem. There's a possibility that these skin symptoms are dangerous signs coming from your internal organs, so please remember this. If you have experienced any of these symptoms in the past, please let us know in the comments section. I think it will be helpful for others as well. Now in the second period, I'll introduce you to the dangerous cancer signs that are indicated by symptoms like hoarseness or nasal congestion, which increase your risk by as much as 53 times. Many of you have likely had hoarseness or nasal congestion occasionally, assuming it's just a cold or lingering symptoms and continue working at home or your job despite it. However, I'll introduce you to the real dangers and risks that can be hidden behind those symptoms, including specific research findings. The first sign is prolonged hoarseness. It's common to lose your voice after going to karaoke, talking too much at work, or catching a cold, right? However, if your voice becomes hoarse or raspy without any obvious cause, such symptoms could actually be a dangerous sign of cancer. When you think about the reasons, it's actually easy to understand. Please take a look at this image. Actually, there is a nerve called the recurrent laryngeal nerve that controls our throat. This recurrent laryngeal nerve, it goes from the brain to the throat, but it first goes down and then turns back up. So if the recurrent laryngeal nerve is damaged along this path, if it is destroyed by something like cancer, the nerve in the throat is impaired and you can't produce your voice properly. You can't regulate the function of your throat, so your voice becomes hoarse or air escapes and you can't make a sound. Even if you try to say something like hello normally, your voice won't come out as a sound, like hello. These kinds of symptoms can occur. What kind of cancer is likely to affect the so-called recurrent laryngeal nerve? Please think about its pathway. First, if cancer forms in the throat or thyroid, it's called thyroid cancer, and it can spread to the lungs. Lung cancer can also cause hoarseness, and of course, cancer of the throat or larynx can also make your voice hoarse. It's surprising that lung cancer can cause hoarseness. You wouldn't think that, right? But if you consider the reasons I just mentioned, I think it's easier to remember, so please remember this together with me. Well, I understand that, but isn't it a rare case? If you thought that, actually, it's not so rare. According to a study published in Europe, patients who continue to have hoarseness with an unknown cause have about 7 times the risk of being diagnosed with lung cancer. And when it comes to laryngeal cancer or throat cancer, the risk jumps to about 53 times. I think you can now understand just how dangerous a symptom hoarseness can be. If you think it's just a cold but it turns out to be cancer, you might regret not finding it sooner. So if your symptoms last for a long time, and especially, please remember that hoarseness or a raspy voice without a clear cause could be a sign of cancer risk. Here's one point from me. If your symptoms gradually get better over time, it's unlikely to be cancer. And if you catch a cold and your throat becomes hoarse at the same time, it's common to have other symptoms like a runny nose, coughing, phlegm, or a fever. But if the symptoms are caused by cancer, you usually don't have a runny nose or cough, only your voice becomes hoarse. If you have symptoms like that, whether you have others too is an important clue. Please remember this together. Now, here's the second dangerous sign. It's nasal congestion, which is also pretty common, isn't it? For me too. When I wake up in the morning and notice my right nostril is blocked, that's something that happens all the time. And especially for people who easily catch colds or have allergic rhinitis, nasal congestion is pretty common, right? However, for these people, the risk of cancer increases, so I want you to be careful. First, if you always have nasal congestion on one side that doesn't improve with medication and keeps getting worse, if your nasal discharge smells bad or comes with nosebleeds, how about it? Actually, cancer can develop in various parts of our body, and it can also occur in the nasal cavity. In fact, nasal congestion is a typical symptom of cancer in the nasal cavity or paranasal sinuses. Medically, it's called nasal obstruction. About 60 to 80% of patients with nasal cancer had nasal congestion as an initial symptom, so please be sure to pay attention to it. According to a study that reviewed various research, patients who have chronic nasal congestion on one side are different from those who have temporary or alternating congestion on the right or left side. The results revealed that patients with chronic nasal congestion on one side had a 50 times higher cancer risk than those with regular congestion. If you've had frequent nasal congestion, but the other nostril is clear, since it's not too uncomfortable, you may want to continue working or doing chores. Still, please consider visiting a hospital for a checkup. Visit your regular hospital where you feel comfortable, or see a nearby otolaryngology, ear, nose, and throat clinic, as they are specialists. Please consult one of these departments. Here's my point. When it comes to allergies, if it's rhinitis, it usually occurs on both sides. It's not normal for it to happen on just one side, so please pay attention if you have nasal congestion on only one side. Also, the nasal mucosa can swell on one side while the other remains clear, then switch sides over time. Then the other side of the nose clears again. The nasal mucosa repeatedly swells and returns to normal. However, nasal congestion caused by cancer is different. Instead of coming and going, you basically have a constant feeling of stuffiness. If it lasts a long time or doesn't improve much, it's a higher risk and more dangerous. Please remember this. Second key point, hoarseness or a raspy voice lasting over a month raises laryngeal cancer risk by 50 times and lung cancer risk by 7 times. I mentioned that persistent, hard to treat nasal congestion on one side strongly suggests nasal cancer. If you thought, that's surprising, or I didn't know that, I want to remember it, please hit the like button. And if you want to remember it, please leave a comment, even just a word or two about what you want to remember. Sharing key points at YouTube Medical University as an active doctor helps others and makes it easier for you to retain knowledge by taking action. We explain medical information clearly, including the reasons behind it, and we'll keep sharing key updates to help you live vibrantly in your later years. Please subscribe so you don't forget which channel this is. Here's what you've been waiting for. In the third period, I'll show you how to check for cancer yourself. Is self-checking really possible? Usually it's tough, so I've covered various symptoms here at YouTube Medical University. Still, some symptoms are easier to check on your own. These are lumps under the skin. In cases like malignant lymphoma, a cancer where lymph nodes swell, it's crucial to check for these lumps, so please remember this. In addition to that, cancers that develop inside our bodies can also float and move through the bloodstream. They then flow through the lymphatic vessels, where there are checkpoints called lymph nodes, as I mentioned earlier. Since these are responsible for immunity, if cancer cells pass through the lymph nodes, they can be stopped at these checkpoints. The lymph nodes swell up as they try to fight off the cancer cells. When that happens, it actually appears as lumps in the skin or in the lymph nodes. That's why being able to feel your own lymph nodes is very important for the early detection of cancer. I had a patient like this. This was a man in his 40s, Mr. B, who was in the prime of his working life. One day, while washing himself in the bath, Mr. B noticed a lump about the size of a marble on his neck. Since it didn't hurt, he thought maybe he was just tired, but even after a month, it didn't go away at all. In fact, he felt like it was getting a little bigger. So, he came to the outpatient clinic. As you might expect, Mr. B was diagnosed with malignant lymphoma. He was referred to hematology and began treatment early, so he is still working and doing well. For example, like Mr. B when you bathe. I think it's very important to make it a habit to check your lymph nodes and any lumps on your skin as part of your daily routine. And now I'd like to share some key points with you. Lumps on the skin caused by cancer have certain characteristics. I'll introduce 3 key points to help you identify these dangerous lumps. The first point is this: they are painless. When you catch a cold, your throat hurts. Have you ever had swollen lymph nodes in your neck? They hurt when touched, right? But swelling of the lymph nodes caused by malignant lymphoma or cancer metastasis to the lymph nodes often doesn't hurt. That's why it's scary. Because it doesn't hurt, some people think it's okay to ignore it, and there are many patients who don't even notice it. Cancerous lumps from malignant lymphoma can develop in any lymph node, such as the neck or armpit. They typically don't hurt and feel rubbery and soft. Some patients might think it's just a lump of fat or something, but like with Mr. B, if it doesn't get smaller or actually gets bigger, you should definitely consider seeing a doctor at a hospital. And the second point is the size of the lump. Even healthy people can sometimes feel lymph nodes that are less than 1 centimeter. However, generally, if it's about 1.5 centimeters, that's about the size of a broad bean or a pea. If you can feel a lymph node about this size, there's a much higher chance that it's an abnormal lymph node. Many people think that swollen lymph nodes from cancer are always very large, but even around 1.5 centimeters can be a sign, so please be careful. The third characteristic is that it gets bigger over time. Cancer cells basically do not disappear on their own naturally. Once a lump forms, it tends to gradually get bigger. So even if you find a lump and think it might not be a big deal, make sure to check it every day and see if it's getting any bigger. If you can see it on the surface of your skin, for example, you can take a photo and compare it a month later to see if it's gotten bigger. This makes it easier to notice changes, and if you bring those photos to the hospital, it also helps us understand your condition better. So where are the lymph nodes that we can feel from the surface of the body? The first place is the neck. When you turn your head to the side, the line just below your earlobe, this is where lymph nodes are hidden. So when you're taking a bath, try touching these areas and check if there are any lumps. The second area is the armpit, which also has many lymph nodes. Gently massage from deep inside the armpit toward the front to feel them. It's effective to check if you can feel any lumps when you do this. And the third place is the groin area. Actually, the groin area is also easy to feel from the skin. It doesn't matter if it's when you're going to bed or when you're washing your body. Please make it a habit to firmly check if you can feel any lumps. Even such a small habit or bit of knowledge can increase the chances of saving your life or the life of someone important to you. Please remember this. Let's review what we've covered so far. The first point was about signs on the skin. Be careful with unexplained itching, shingles, and hives. And in the second part, we talked about hoarseness and nasal congestion. I explained what kinds of hoarseness and what kinds of nasal congestion are more likely to indicate cancer. Please try writing it in the comments section. If you're wondering what were those features again, please review the second part. And in the third part, I introduced the habit of checking the lymph nodes in your neck, armpits, and groin for dangerous lumps. What were the characteristics of lumps caused by malignant lymphoma? I introduced 3 of them. Please check if you remember them. And actually, malignant lymphoma is rapidly increasing right now. I've posted videos about this in the past, so if you want to know more about other symptoms, please check the description below after this. I talked about a lot of things, so if you think you can't remember all of this, that's Okay, if there's one thing I want you to take away today, is that symptoms that don't go away and whose cause is unknown should be a reason to visit the hospital. Many cancers are found starting from there. If something feels different from usual, if things are getting worse and you can't think of any reason why, at times like that, be sure to go to the hospital and explain to the doctor in detail what feels different from usual and what exactly is wrong. For example, if you want to put what you learned today into practice, check your entire skin every day when you take a bath. Next, sing a bit to check if your voice is hoarse or your nose is stuffy. Check it, and while washing your body, check for any lumps. Just by doing this, you can check everything, so please give it a try. It was a long video, but thank you for watching until the end. We are always here supporting your health. We look forward to seeing you again in the next video. Commenting your thoughts on the video motivates us, and a thumbs up would make us happy. Let's meet again in the next video. I'm a general practitioner and I'll share how my patients live without aging in their 70s. I want to live this way too. Who knew such a lifestyle existed? This video is full of patient stories. Is talking with friends more important than exercise? In medicine, less can be more. These are lessons from my elders on staying healthy at any age. It offers great advice for happy living. Check it out in the description below.